After having done the active range of motion assessment, I want to now try to determine the individual segmental movement. So I'm just going to have my patient lying on the side here. I'm going to start by doing a bilateral flexion technique. So I'm just feeling for flexion with my fingers palpating the interspinous space between L5 and S1 as I flex bilaterally. Now I'm going to take her back into some extension. I'm just trying to note the range of motion and whether or not there's any irritability or stiffness or restriction. So that feels not too bad. Now we're going to do an individual asymmetrical flexion and extension technique, which is associated with an inferior and posterior glide for extension and an anterior and superior glide for flexion. So I'm going to assess the right L5S1 facet, and I'm going to just try to introduce an inferior posterior glide, primarily using my right hand to do that. And I can feel a restriction occurring there. And that might correspond with a little bit of tenderness on my patient's part. Now I'm going to do a unilateral flexion assessment of the right L5S1 joint. This time I'm using more of my left hand to create a flexion associated glide through the pelvis, and that feels pretty good. So I've found a restriction of the right L5S1 facet joint, and I've decided I want to treat that to try to restore that extension loss. So to do that, we're going to do something called locking with our patient, and that just creates a more effective way to localize that treatment force to the L5S1 facet joint. So I'm going to grab her left arm, and I'm going to pull it at about a 45-degree angle up towards the ceiling, inducing right rotation. My index finger is palpating L4 and L5. When I start to feel a bit of movement happening there, I'm stopping with that pull. Your hand is now going to rest underneath your head. Just going to slide my hand back underneath, so I'm monitoring the L5S1. And I'm just going to bring that top leg up. I'm going to straighten the bottom leg a little bit, keeping that just neutral at L5S1. And that top leg is just kind of hooked in behind the bottom leg there, just to induce a little bit of pelvic rotation, and that's completing the tightening from below. So now I know my force is localized to L5S1. I'm going to get in, and I can do an extension associated mobilization here using my left arm on the pelvis. I can create a little bit of an extension mobilization. This is a grade 4 mobilization. I could also do a distraction mobilization, so I can kind of log roll her into knee a little bit, and I could do a grade 4 there. I could progress either mobilization to a grade 5 manipulation if I wanted to, or I could downgrade it to a grade 3 if I wanted to. So if I come back to the extension mobilization, here a grade 5 would look like this. And that's it. Afterwards, I might want to just reassess the glide to see if it feels improved. If I was effective with my assessment and my technique, there should be some increase in movement at that L5S1 level, and there is. Thanks.